have now your blood vessels. What would be the arteries and veins here? We have arteries. Okay, and veins in the infratemporal fossa. So again, you have here your zygomatic bone. You will move the zygomatic arch. What is this one here? This is greater wing of sphenoid. Okay? Tanggalin natin to. Okay? So you have now here, what is this one here? You have lateral pterygoid blade. This is greater wing of sphenoid. This is lateral pterygoid, yung sumulat, lateral pterygoid blade. Okay, yan, greater wing of sphenoid. Okay. Now, of course, you have here your, this is the temporal bone. Okay. Now, I have to put this one back. You have, okay, I have cut the portoid process, and you have here the thyroid cartilage. And you have here an artery na ito, left, common, thyroid. And you have here, what is that? External, internal. External carotid artery, this is internal, this one is, this one is left common, carotid. Ay, sumulat sila. You have here external carotid, and this is the one that you find inside the parotid gland. Ano nga nasa loob ng parotid gland? Facial. Anong artery? External carotid. Anong vein? Retromandibular vein. Okay. Now, at the level of the neck of the mandible, this one divides into two. The one that goes here in the infratemporal fossa, sa loob. At saka yung isa, nagpunta dito sa labas. Okay? Ano nga yan? Branches na yan? Okay. Internal maxillary at saka superficial temporal. So ito yung nasa infratemporal fossa, right? What is this? Internal maxillary. And there will be lots of branches coming from here. And the pterygoid muscles, the lateral pterygoid muscle, will divide these into three. Okay? So below the lateral pterygoid, you have the first portion. Okay? Along the lateral pterygoid, second. And the third will be passing here in what you call sphenopalatine fossa. Ano yan? Sphenopalatine fossa. Kung saan nandun yung sphenopalatine ganglion. Okay? So there will be lots of branches here. Like, you have here your first portion, okay, below the lateral, second, along the lateral pterygoid, and third, there in the pterygone or sphenopalatine fossa. Coming from the first, you have branches going to your tympanic membrane, okay, and your external acoustic meatus, okay. And then, you have also branches going here to your, what is that? To your, lagyan natin to. To your foramen spinosum. Ano kaya yan? Middle meningeal. And there's a branch coming from the first going here in the mandibular foramen. Ano kaya yan? Inferior alveolar. Okay. So there are lots of branches. We will not be studying them, okay, in detail. Basta ang importante, you know where they're going, right? So coming from first, you have middle meningeal. This is middle meningeal artery. This is what? Inferior alveolar artery. Okay. Inferior alveolar artery, it is the one, okay, is the one that will be coming from the first portion, right? That is inferior alveolar artery. From the second portion, usually these are all muscular branches. Okay. And the third portion, you have a branch going to the nose, sphenopalatine artery. You'll be having branches going to the your posterior part of upper lip, posterior superior alveolar, like that, or descending palatine, going to the palatine. So, ang dami niya branches, no, coming from your main trunk of the internal maxillary. So this is the artery that you find, okay, in the infratemporal fossa. This is cytomatic bone. So this is all infratemporal fossa. Okay? So ang importanteng branches dito, first portion is middle meningeal, inferior alveolar. The second is mostly muscular branches. And the terminal branch of this is sphenopalatine artery. Okay, that will go to the nose, no? And you'll study that now when you go to your nasal cavity. And this will be accompanied by, what is this one here? This is lateral pterygoid, right? So this is lateral pterygoid here. You have lateral pterygoid, and there will be veins around this. And these veins here, you call this one pterygoid plexuses. What do you call them? Pterygoid plexuses. You have pterygoid plexuses of veins. And these pterygoid plexuses will join to form internal maxillary vein. Internal maxillary will join with, what's that? Superficial temporal. You form now here a vein. What's that? Retromandibular vein. So this is now retromandibular vein. So nag-umpisa yan sa, ano to? Pterygoid venous plexuses. Okay, and they join to form internal maxillary vein. Internal maxillary vein joins with superficial temporal to form retromandibular vein. Of course, you know what will happen. Divides into anterior and posterior division. Okay. So these are the most important structures that you find. Okay. Again, what are the structures embedded or passing within your aortic gland? What is the nerve? Fascia. What is the artery? What is the vein? The other name is posterior. Okay. What are the structures that you find here in the temporal fossa? What is the muscle muna? It's covered by fascia. Itong nasa labas niya, superficial temporal, right? Nasa labas ng puti na nag-cover dito. Okay? So, it's superficial. A branch superficial, ito naman, di ba nandito yung temporalis fascia? Tapos nandito superficial? Okay, tinanggal yung temporalis fascia. You see an artery here coming from superficial temporal. That is middle temporal. Tapos yung nasa ilalim niya, sa ilalim nito, deep temporal. Galing ngayon sa second part ng, ano to? Internal maxillaris. Kasi second part ay mostly muscular. Right? Okay. So, ano naman yun dito sa infratemporal fossa? What are the muscles that you find here? Lateral pterygoid. Ito? Medial pterygoid. What nerve do you find here? Anong nerve yun nandyan? Ay, yung muna. Anong nerve yun? Labia. Which divides into anterior and posterior. And the anterior, mostly it will be motor. Siya nanggaling yung deep temporal. Okay, lateral pterygoid, mesenteric nerve, right? At saka yung buccal, isang sensory. And then yung posterior na tatlo, ano yung orange? Lingual. Na sumama yung blue? And another branch is the green, inferior alveolar. And the third branch is the violet. Okay? And this one will be auriculotemporal nerve. Okay, so the violet is the auriculotemporal. Okay, so that's it. This will be included in the theoretical. Okay?